it's Ashley from the social media team coming to you from HIMSS on day 3. I'm here with Mandi Bishop, the one and only. And we're talking about healthcare and HIT. How you doing, Mandi?
Fantastic and fabulous, and we're wearing pink because what do we do on Wednesday?
We wear pink on Wednesday.
That's right.
Yeah, on Wednesdays we wear pink. So day 3, how are your feet?
Day 3. You know what? My feet are fabulous, and let me show you why.
Color coordinated. The pink socks.
That's right. Color
too?
coordinated, pink socks, purple, pink, and seafoam green sneakers, and I always wear my sneakers. I wear them unapologetically, and my feet are fabulous.
I'm taking a page out of your book next year because I'm dying. I'm dying today. So breakout topics in HIMSS.
Yes.
What are you seeing? What do you like?
You know what I've been thrilled to see at HIMSS? I have seen a couple of sessions where there is the patient experience being told by the patient.
Yes.
So I have seen a couple of sessions. There's one tomorrow. There was one yesterday with my dear friend Max Stroud and her sister Beth Stroud.
I love Max Stroud.
Wow, it was wonderful. And she was talking about her lung cancer experience and the journey that she had to go down, even as an educated, engaged patient with healthcare activism experience, like how difficult it was for her to navigate our industry. And so to hear the patient stories told from the patient's perspective and not to hear us talking about the patients, that was incredibly valuable. And I know that there's another one tomorrow, so I'm very, very excited to see those sessions peppered throughout the HIMSS experience.
Right, I love it. I know that you're all about the patient story.
Totally.
Too, so that's right up your alley.
Yeah.
So what are you most curious or most excited about for healthcare in the next year or two?
I really want to see how we are going to first adjust to the rapidly changing regulatory environment that we're going to see and unfold over the next couple of years. I think that we have been inflicting agile on the waterfall world of healthcare for a long time.
Sure.
And I think that we are going to get exercise in being able to continue that adjustment and being able to go not just from agile to RAD, like rapid application development, but rapid application development about the entire industry and how we are going to transform in a very quick reactionary way. So I'll be very curious next year at this, at HIMSS next year. I want to see how much progress have we made in understanding kind of what that new regulatory space looks like and how that would translate into our opportunities and challenges here.
Sure.
And I think over the next decade, AI, I think that as we start to see culturally, I think overcoming kind of the cultural paradigm about physicians and clinicians and radiologists being concerned about AI taking over their job. Like, is it man versus machine? I think as Jenny was saying from IBM, is it man versus machine or is it man and machine? So I think, man with machine. I think that as we begin to embrace that concept, it's going to free us to do our highest and best use of our time, of our energy, of our empathy. I think it's going to help return the humanity to healthcare, interestingly enough, the more we adopt those technologies.
Because it gives you more time to be face-to-face with the patient instead of doing paperwork.
Yes.
Yeah, makes perfect sense.
Yeah.
All right, last question.
Yes.
If you had an SMA ambassador to tell our audience to follow.
Absolutely. Okay. So there are a couple, so I'm going to give you a few.
Absolutely.
If you want to know about workflow and if you want to know about makers, you need to follow @Wareflow, WAREFLO, and that is Chuck Webster, and he is doing. Chuck is amazing, right? He also has an alternative hash or an alternative handle called @Mr. Rimp, and that's MRRIMP, and that's the robot in his pocket, and it's advocating for the makerspace in healthcare. He's amazing. He puts brilliant workflow and makerspace content together. He writes a book with every blog post. So the informative amount of content is phenomenal. I also have to give a shout out to someone who is not a social media ambassador, but who is part of the reason why I am here, and that is Healthcare Wen. So Healthcare Wen, and that is Dr. Wen Dombrowski, and so she is a physician. She has recently embarked upon a new consulting venture around AI and machine learning for healthcare called Catalyze. So Healthcare Wen, highly encourage that everyone follow Wen.
Yes, absolutely. Thank you so much for being with us.
Thank you.
We enjoyed it. So fetch.
So fetch. Totally fetch. We made fetch happen.
We did.